Hey everybody, this is John Oxley again with Huntington Physical Therapy doing my Friday tip of the week. We've talked about some arthritis. We had a couple videos on that. I wanted to highlight another one of our physical therapists and some of the things that she does. This is Aleacha Wallington. She's been with, 6 years? You've been?
7.
7 years with HPT. She sees some Parkinson's patients. She has a specialty in that. That's what we're talking about today. She also is a certified hand therapist, so she sees all kinds of hand injuries. So we'll be highlighting some of the stuff she does with that later on. But today we're going to talk about some Parkinson's patients and what we do in physical therapy, or what specifically Aleacha does. So let's get into it. With Parkinson's patients, they've gotten a diagnosis. When would you like to see them as a physical therapist? When's the best time?
Ideally, when you're first diagnosed is the best time, but I've seen patients literally from the first couple weeks they've been diagnosed all the way up till years later. So there's different things we can do based on your symptoms at that point. But ideally, to get the ideal, most effective treatment, I would see you as soon as you're diagnosed and they get your medication under control.
So the sooner the better, basically. Right. Okay. What types of things can you help people with? Can physical therapy do for Parkinson's patients?
So some of the big things with Parkinson's are the tremors, the slowness of movement, taking shorter steps, postural instability, which typically is balance and coordination issues, and then the rigidity. So lack of trunk rotation, a lot of stiffness in the back and hips, those sort of things.
So specifically getting into kind of the treatments, how often are you seeing these people? How many times are you seeing these Parkinson's patients?
So I do a specific treatment called LSVT Big. That therapy is 4 times a week for 4 weeks. It's a very intense month, but that's the most effective treatment I've found for Parkinson's. I've done variations of that treatment. It's really based on, one, the commitment you're willing to make, the time you have, that sort of thing. So ideally we do the 4 times a week for 4 weeks, but I've also done where we see people twice a week for 8 weeks and just do a different type of program.
And now part of that program is they get a lot of homework and things that they need to do. Talk a little bit about what the expectation for them is at home.
So the first thing I tell anybody doing this specific program is that you have to commit. So I need a full month where you can come to therapy 4 times a week for 4 weeks. But on top of that, you have homework. So basically, you're working out twice a day. And it's 20 to 45 minutes. It's not like you're working out for 2 hours at home. But I need you to commit during that month to the fact that this is going to be a long month. I'm going to commit to getting myself better. And then after that, I try to get people to exercise 4 to 5 days a week.
And how is it physically taxing, these exercises, or is it fairly easy? They just need to go through the program?
So part of the big program is that it has to be moderately to high intensity exercise. So it needs to basically to be to the point where you can't hold a conversation with the person beside you, but it's not so intense that people don't typically complain of like soreness, or they're so tired they can't move, they can't get through the rest of their day, or anything like that.
Okay. And now, if we've got some people watching this video, they have Parkinson's, they've been diagnosed, do they need a referral? Can they just call? How does that go?
We do not require a referral. The state of West Virginia doesn't require a referral, but some insurances do. So basically what you can do is call us. We can figure that out. We can even do the consultation and then figure that out afterwards.
Okay. So you're willing to just kind of screen people and discuss the process with them if they're interested in doing that before the therapy?
Right.
Great. Now, we have a Parkinson's support group at HPT that Aleacha has started. Give us a little bit of info about that. How often, how long does it last, and what do you hope to accomplish?
So I do the Parkinson's support group for my patients to kind of keep an eye on their progress after they complete the Parkinson's program. It kind of gives me a way to keep them accountable for their homework at home, and then if I start to see any kind of declines, we catch it early. We do it the second Thursday of every month at noon. It lasts till about 1 o'clock. We cover some sort of short topic like motor symptoms, non-motor symptoms, what PT does for Parkinson's, what Parkinson's symptoms are, And then we usually run through the exercise program just as kind of a reminder and to make sure everybody's still doing things correctly.
Now, there is lunch involved, right?
Right.
You give free lunch and dessert?
Yep. Oh, at least usually a snack of some sort.
Okay, well, I mean, that should be reason enough if you're a Parkinson's patient to
Right.
come. Well, hopefully that was good information. If you have further questions, you can call HPT. You can ask for Aleacha. She'd be happy to talk to you further about your Parkinson's treatment. If you have any questions or comments, you can send them to us on Facebook. Appreciate you guys watching, and we'll be back next week.